do we diagnose chronic kidney disease or kidney disease? Basically, of course, the physical exam is the main. I mean, because we have to suspect, we might see some of the liquid retention that you're having, or some certain pain, or certain or your blood pressure might be high, so we start to suspect this. Of course, the way we measure how the kidney is working is that we try to measure some substances that are supposed to be filtered by the kidney. So if they're getting accumulated in the blood, then we know the kidney is not working properly. One of those substances is called the creatinine. So that's one of the ways we do it, and it's on the basic metabolic panel, which it's a very very regular test that we do. That's the way we do it. We can also look at urine, which at first might seem like the best choice, but not necessarily. It's better to do it in the blood for the renal function. But then there are certain things that we might see in the urine, for example, proteins. In the normal kidney, most proteins are not supposed to be filtered because their size is very big. But when you start having kidney failure, then those proteins start to flow freely through the kidney, and you start seeing them in the urine. So of course, having proteins in the urine is definitely a sign of kidney conditions. That's the reason why we have to do this at least once a year for patients that have diabetes and high blood pressure. We do require a urine test. So maybe you were wondering why your doctor did it, no matter you're a man or a woman. Maybe he was trying to look for proteins in the urine, which is an early sign of kidney disease. Ultrasounds, basically, they are good for many conditions of the kidneys. We can see kidney stones. We can see certain inflammation in certain infectious diseases. We can also see the size. Of course, when the kidney starts to not functioning well, the size starts to decrease, and the relation between the center and the cortex begins to change. So that's something we do also. We can look at the whole urinary tract by basically injecting a dye to see if there's any obstruction. That's also something we could do also. And of course, we have the same MRIs and CT scans, which are also very useful.